The following portion of Daytime Tri-Cities is sponsored by HMG.
Well, hello everyone. We are here at Holston Medical Group's Primary Care at Sapling Grove in Bristol, talking today about prevention. You've often heard the phrase, an ounce of prevention is worth a pound of cure. Is that the right phrase? That is the right phrase, right?
That's the phrase.
We are here with Dr. Chuck Bolick. And first of all, thanks so much for meeting us out here today.
Well, thanks for having me.
Tell me a little bit about how important it is and the prevention side of especially what you do here at the office.
Well, there's no question. It's been known for a long time that the American healthcare system does not get the bang for their buck that has been put into it. We excel at illness care, but we've found ourselves behind things in terms of preventing, some of which is self-inflicted, obesity and smoking and that kind of thing, but also just not letting people know what's out there. So we've, over the past several years, just, medicine as a whole has made a concerted effort to really try to improve that, trying to work with people to get them looking at things to try to improve their health.
So how can we find out kind of what's covered and how we can save money and find those preventative things as consumers?
As far as coverage goes, unfortunately, you're stuck with talking with an insurance provider. Our role primarily is to sort of sit down and say, okay, for you at this point in your life, the things that are most beneficial to you would be whatever. At a 25-year-old, let's make sure your blood pressure is okay. Let's make sure your weight is okay. Check what your cholesterol looks like. If you're 50-year-old, then mammograms, pap smears for the ladies, colon cancer screening for everybody. So it'll vary, but and there are different guidelines out there, and it can be confusing even for us who do this on a daily basis. Back in the old days, the Marcus Welby model was, you'd go to the doctor, and the doctor would say, well, here, you do this. And of course, that's not really how we approach things these days. It should be more of a partnership, so where we could say, the guidelines would suggest you could do this. There's a couple of different ways of approaching it, which one appeals most to you, and, work together to find whatever that solution is that works for the patient. And again, part of that goes through figuring out the cost of things. Some of the screening can be fairly expensive. Thankfully, most of the plans are getting better about covering those things. But there's still some folks out there that don't have the coverage, and that makes for a struggle.
So it sounds like really, too, it's key to have that relationship with your physician, like for you with your patients, to be able to really navigate that road of prevention together so they are getting those important screenings. That's
when it works the best, is when we, working together. That's the ideal we shoot for.
All right. Well, certainly some great information, Dr. Bolick. Thanks for taking the time to chat with us this morning.
Thank you.
For more information, you can always check out the website. You can check out the Health Matters blog as well. It is holstonmedicalgroup.com.
The preceding portion of Daytime Tri-Cities was sponsored by HMG.